Hello, my name is Nzingha Whitlow, and I'm a LPN to BSN student nurse at Indiana State University. Today, I will be presenting my health education project about culture diversity. How does it impact quality of care? Population at risk, PAR. The population at risk is any patient under the care of a healthcare professional that holds a personal bias against them. Learning objectives. My objectives for my project is: what is cultural diversity? Why is cultural diversity crucial in healthcare field? Treating an individual holistically by incorporating patients' cultural needs. Components of culturally competent care. If you would please stop and take a minute to take the pre-test to gauge your prior knowledge, and then after the presentation, you will take a post-test to check your knowledge progress. Also, please check out my brochure. The links for the pre-test, post-test, and brochure is in the description box below. Thank you. What is cultural diversity? In recent humanity, healthcare diversity may refer to a number of qualities, including but not limited to the following characteristics: race, ethnicity, gender, age, sexual orientation, religion, political beliefs, education, physical abilities and disabilities, socio-economical background, language, and culture, according to Writers 2020. With our country growing more diverse each year, natural progress would suggest so too should fundamental institutions such as our government, our schools, and our healthcare facilities. While all undeniably important, the latter of the three has arguably the most potential for negative community-wide impact when lacking in cultural competency. Healthcare providers should respect patients' opinions, rights to possess points of views that the medical professional may think is insufferable, or overlooking what the healthcare professional deems to be the patient's blemish. Acceptance and tolerance is a crucial characteristic for healthcare professionals to possess. There is zero leeway for being condemnatory, which while working in the medical field. Tolerance cannot be stressed adequately in a society where countries are incessantly in a state of war. Diversity affords an opportunity to learn from the patients while respecting and valuing their difference in religion, sexual orientation, political preference, ethnicity, and so forth. Right 2020. Why is cultural diversity crucial in the healthcare field? Cultural diversity is the medical field. In the medical field, is when a healthcare provider incorporates a patient's religion, sexual orientation, political preference, and ethnicity in the patient's care plan to treat the patients as a whole, as opposed to just their physical elements. Medicine is highly homogeneous field serving diverse populations, and that's a problem. Diversity in healthcare goes far beyond a language barrier. It is about understanding the mindsets of a patient within a larger context of culture, gender, sexual orientation, religious beliefs, and socioeconomic realities. When a homogeneous workforce is tasked with caring for an extremely diverse array of patients, the quality of care can suffer. Health disparities affect segments of the population differently. Attitudes towards healthcare and treatment can vary among different populations. Medical professionals need to provide custom care that acknowledge and recognizes these differences. The medical field needs diversity in order to serve its diverse patient population. Treating an individual holistically by incorporating patients' cultural needs. Cultural respect is vital to reduce health disparities and improve access to high quality health care, as is responded to patients' need according to the National Institute of Health. Nurses must respond to change patient demographics to provide cultural sensitive care. This need is strikingly evident in critical care unit. Physical, social, psychological, spiritual, all encompasses a human being that where a healthcare professional is treating. Holistic care. Components of culturally competent care. Cultural awareness involves self-examinations of in-depth exploration of one's cultural and professional background. This component begins with insight into one's culture, health care, beliefs, and values. A cultural awareness assessment tool can be useful to assess a person's level of cultural awareness. Cultural knowledge involves seeking and obtaining an information based on different cultural and ethnic groups. This component is expanded by assessing information offered through sources such as journals, articles, seminars, textbook, internet sources, workshop presentation, and university courses. Cultural skills involve the nurse's ability to collect relevant cultural data regarding the patient's presenting a problem and accurately perform a culturally specific assessment. The Ginger and Davanzar model offers a framework in assessing cultural, racial, and ethnic differences in patients. Cultural encounter is defined as the process that encourages nurses to directly engage in cross-cultural interactions with patients from cultural diverse backgrounds. Nurses increase cultural competence by directly interacting with patients from different cultural backgrounds. This is an ongoing process. Developing cultural competence cannot be mastered. Cultural desire refers to the motivation to become culturally aware and to seek cultural encounters. This component involves a willingness to be open to others, to accept and respect cultural differences, and to be willing to learn from others. This is my reference page. I used 3 sources to complete my project. Also, there are additional sources if you are interested in reading more about cultural diversity and how it affects the health care community. Thank you. I hope you enjoyed. Have a great day.